Hello again, my student. Today we are going to talk about the management of patients with cancer. Before we know how to manage the patient with cancer, we should know some definitions. Those definitions are cancer. The cancer is a disease process whereby cells proliferate abnormally, ignoring growth-regulating signals in the environment surrounding the cells. The carcinogenesis. The carcinogenesis is a process of transforming normal cells into malignant cells. Oncology. The oncology is the field of study of cancer. Biopsy is a diagnostic, as we know, it's a diagnostic procedure to remove a small sample of tissue to be examined microscopically to detect malignant cells. Metastasis, spread of cancer cells from the primary tumor to distant sites. Hyperplasia. So the metastasis, as we going to talk about it, it is found, or we should found it as a characteristic of malignant cell. Also, there's hyperplasia. Hyperplasia is an increase in the number of cells of a tissue, most often associated with periods of rapid body growth. Metaplasia. Metaplasia is conversion of one type of mature cell into another type of cell. The alopecia is hair loss. Malignant. When we are going to talk about cancer, we should talk about malignant. Having cells or process that are characteristic of cancer. Palliation. The palliation is one of the treatment type for the cancer patient, which is relief of symptoms associated with cancer. The chemotherapy, use of medications to kill tumor cells by interfering with cellular functions and reproduction. The radiotherapy, use of ionizing radiation to interrupt the growth of malignant cells. Apoptosis, programmed cell death. So, in this slide, we have to talk about the comparison between benign and malignant tumors. The benign and malignant tumors have some characteristic to be differ from each one from the other. The growth rate in the benign is typically slow expansion, while in the malignant, often rapid, with cell numbers doubling normal cell growth. Malignant cell infiltrate surrounding tissue, while the cell features in the benign typically of the tissue of origin, while in the malignant are typically in the varying degree of the tissue or origin. Altered cell membrane contains tumor-specific antigens. Tissue damage. In the tissue damage, when we are going to talk about the tissue damage, the benign tissue damage is a minor, while the malignant is often cause necrosis and ulceration of tissue. The metastasis. In the benign, there is no metastasis, while in the malignant, often spread to form tumors in other parts of the body. The recurrence in the benign is a sudden recurrence after surgical removal, while in the malignant, also we are seeing the tumor or the recurrence of tumor is obviously seen even after the surgical removal of the following radiation and following the radiation and chemotherapy. Related terminologies. To the benign, the related terminologies is hyperplasia, polyp, and benign neoplasia, while in the malignant, the related terminologies, we see cancer, malignancy, and malignant neoplasia. Prognosis of the benign tumor is not injurious unless location causes pressure or obstruction to a vital organ, while the prognosis of malignant is unfortunately the death if uncontrolled. The types of tumors. There's many types of tumors. It is classified according to, or it take its characteristic, it names by its characteristic or the tissue origin. So when we are going to call the first one as fibroma, we know that the character of it is a benign and the origin of it is a connective tissue. When we are going to talk about lipoma, it's also by the character is a benign, while in the origin it's a fat tissue. The carcinoma is the most often type of tumor, reach the high incidence. So we can see it in the tissue of skin, glands, and digestive, urinary, and respiratory tract linings. So it's the most spreading one. When we are going to call it a carcinoma. The sarcoma, we are seeing the connective tissue tumor as a benign form is a fibroma, while in cancerous form is sarcoma, the connective tissue including bone and muscles. Leukemia, when we are talking about leukemia, we know that the blood is the origin of this tumor. Plasma cells and bone marrow also. And also we know it's a malignant tumor, not a benign one. Lymphoma, cancerous in character, lymph tissue in origin. Melanoma, cancerous in character and skin cell in origin. This picture is an estimated new cases or cancer cases in United States for the two sexes or two genders in 2001. It have a difference in 2016. I wrote it I read it in some lectures and in some articles. 2016, the acceleration in the cases are differ for this picture. This picture shows that the higher incidence is in the breast cancer and by the female, and in males the high incidence is in prostate cancer. While in the death, this picture is talking about the estimated cancer death in United States by 2001. The highly incidence, the highly death rate or morbidity rate is in the lung and the bronchus by the both sex, while in the 2016 the rate is accelerated in the colon and rectum, cancer. The pathophysiology of malignant process, we are going to talk it by the some brief into understood it. Cancer is a disease process that begins when an abnormal cell is transformed by a genetic mutation of the cellular DNA. Mutation is a term should be known, and we should take it should take place from our in our comprehension for the cancer. This abnormal cell forms a clone and begins to proliferate abnormally. This mutation or genetic mutation gives a signal to the cells to proliferate abnormally, ignoring growth cell regulating signals in the environment surrounding the cell. The cells acquire invasive characteristics and changes occur in surrounding tissues. The cells infiltrate these tissues and gain access to lymph and blood vessels, which carry the cell to other areas of the body, which are gonna to talk it about as metastasis. This phenomenon is called metastasis. Cancer spread to other parts of the body. This is a normal cell. We saw the membrane, we saw the nuclei, the nucleus, the nucleus, the nuclear membrane, the ribosomes, the cytoplasm, the lysosome, the mitochondria. This is a normal cell. And those are the types of DNA and RNA where the mutation occur. These are cell life cycle, normal one, and the interrupted line is the cell growth occur, or where the cell growth signal are ignoring. So there's the point of decision to replicate or differentiate. The differentiation, when the cell is not differentiated to the same type of cell, of the tissue cell, so the mutation is occur. The cell division is mitosis. So in this area of differentiation, the cancer may be occur, or it's occur. Those are some pictures show us types of cancer. There's adenocarcinoma of the rectum and lung cancer. The cancer is a group of cells that grows out of control, taking over the function of the affected organ. Cancer cells are described as poorly constructed, loosely formed, and without organization. Those are the characteristics of cell
when it gets mutated and being cancer. A simplified definition of a cancer cell is a confused cell. It has been confused for the it's ignoring to the signal of growing.
The etiology of cancer. When we are talking about etiology, we should know that the cause of cancer is idiopathic. We don't know what does cause the cancer, but there's a predisposing factor, precipitating factors taking place as etiologies of cancer. They are the viruses and bacteria, and it causes infection, and the infection is considered to be one of the stressors on the cell and act as the when we are going to trigger of mutation. The physical agents, heat or other physical agents, chemical agents, genetic and familial factors also are taking place, such as in breast cancer or in the prostate cancer, which is the high incidence rates when we are talking about. The dietary factors. Dietary factors is one of the most significant or most important factors or when we are talking about the causes or etiology of cancer. Hormonal agents and immune factors. caution. What do we mean by caution? When the patient has been diagnosed as a patient with cancer, there is some warning signs is taking place in his life before this diagnosis. These warning signs is made up, abbreviated to the beginning of those words. It's beginning with those letters which is made a word of caution. The first one is change in bowel or bladder habits. The second one, a sore that does not heal. When we have someone has a sore that fails to heal, so we have to warn about it. Unusual bleeding or discharge, thickening or lump in breast or other tissue, indigestion or swallowing difficulties, obvious change in water or mole, nagging cough or hoarseness. All of those characters or all of those observable change which is taking place in a patient, it made us to be worried about if he had a cancer. So the other thing we should know before we are treated or managed a patient with cancer, the staging system or staging or grading of cancer. This staging called a TNM order or TNM system. This TNM, as in the picture in front of us, the classification of tumor is gonna to be a primary tumor, then it will be gonna to be involved to the lymph node by regional lymph nodes, and then it will be a metastatic cancer. The staging, we have 4 stages: stage 1, 2, and 3, and 4. So when we are classified the tumor as primary tumor, we are given the letter T, the TX, where the tumor is in situ, indicated no invasive or other tissue, we are in stage 1. While the tumor, when it's gonna to be leave its site and go to progress in the another locations, while it's called a local metastasis, not a real metastasis. It's a local metastasis. So we are observe the tumor is increase in its site. We're gonna to be consider that the stage is stage 2, and the tumor is increased by the T1 and T2 and T3 and T4. The regional lymph node. The regional lymph node, when involved, we are going to a stage 3 of grading system or grading of cancer. So when we are given the stage in N0, the N0 is told us that the metastasis is not reach the lymph nodes, while the N1, N2, N3 in stage 3, the metastasis is going to regional lymph nodes. The metastasis is occur in the stage 4 only. The M0 is told us that there is no metastasis, so we are also being in the stage 3, not involved in the going to stage 4. The stage 4 is just M1. When we are going to talk to T3, N2, and M1, so that the tumor is metastatic and have involvement in the lymph node or regional lymph nodes, and it's have a big size, so a T3, so the tumor is big in size and the regional lymph nodes are involved and the metastasis is occur. This picture is talking about the investigations we should take in place to detect the tumor or cancer in the as the patient, as the person, not the patient, any client, any person who reach the MC, the hospitals, he reached the care centers, he should giving a frequent test from this test. So the female should make a test to its breast, or his breast, or she's breast, her breast, by the age of 20 to 39. She should evaluate a clinical breast examination in the every 3 years, breast self-examination every month, clinical breast examination every year, breast self-examination if it being above the 40 year of old, and the mammogram every year above the 40 year of old, of getting year of old. So the colon and rectum, male and female, above the 50, we should make to them a test of fecal occult blood test every year, and flexible sigmoidoscopy every 5 years, and colonoscopy every 10 years, and double contrast barium enema every 5 years. The prostate in male above the 50 or below 50 if at high risk. So how to know that the person has in high risk? We have to make some of investigations or tests called specific prostate specific antigen. The prostate specific antigen told us that if it have a high rate, it told us that the patient is at high risk. That prostate specific antigen above 50 or below the 50 for the persons who is at high risk, we should made it in a frequent of every year. Also, there's the cervix, as the mentioned in this picture, the cancer related checkups, also in male and female checkups, should be in 3 years, below the 40 and above the 40 every year. So the treatment goal may include the treatment goals, as we mentioned, for the patient with cancer may include the first step or the first goal, the golden goal, is a cure, complete eradication of malignant disease, cure, prolonged. So, and the other goal is prolonged survival and contaminant of cancer cell growth, which is called a control. So we have two goals. The golden goal is cure, and other goal is to control of disease, and the palliation, which is relief of symptoms associated with the disease. So the other line of the treatment is surgery. Surgical removal of the entire cancer remains the ideal and most frequently used treatment method. So the surgery, it may be prophylactic or palliative or reconstructive. The diagnostic surgery is the biopsy, which is divided into two types, which is excisional biopsy and incisional biopsy. The surgery as primary treatment remove the entire tumor or as much as the feasible, a procedure sometimes called debulking, and any involved surrounding tissue including regional lymph nodes. So this surgery is called bulking or debulking, which is local excision and wide excision or salvage surgery. The example of it is a mastectomy to treat recurrent breast cancer after primary lumpectomy, and radiation is an example of salvage surgery. The prophylactic surgery. Prophylactic surgery involved removing non-vital tissue or organs that are likely to develop cancer. The example of it is colectomy, mastectomy, and oophorectomy. So the following factors are considered when electing prophylactic surgery: the family history and the presence of absence of symptoms, potential risk and benefits, ability to detect cancer at an early stage, and the patient acceptance of the prophylactic or post-operative outcomes. The palliative surgery is given to the gasping cases. Palliative surgery is also talking about the attempt to relieve complications of cancer, such as ulcerations, obstructions, hemorrhage, pain, and malignant effusions. Reconstructive surgery. Reconstructive surgery may follow curative or radical surgery and carried out in an attempt to improve function or obtain a more desirable cosmetic effect, such as the breast reconstructive surgery. The nursing management in cancer surgery is perioperative nursing care, preoperative assessment, and post-operative nursing care, and patient and family education. The second line after surgery is radiation therapy. Ionizing radiation is used to interrupt cellular growth, as we talking about the radiation and the definition. So we have an external radiation and internal radiation, which is the internal radiation called the brachytherapy. The nursing management in radiation therapy is protecting the skin and oral mucosa. The gentle oral hygiene is essential to remove debris, prevent irritation, and promote healing. And protecting the caregivers is the most significant. Protecting the skin and oral mucosa and protecting the caregivers is the most significant lines or the most important lines in nursing management for the patient with cancer when we given it a radiotherapy. The chemotherapy is antineoplastic. Agents are used in attempt to destroy tumor cells by interfering with cellular function and reproduction. The nursing management in chemotherapy is assessing lines. The first line is assessing fluid and electrolyte status and modifying risk for infection and bleeding. When we are talking about the infection, we know it's a stressor to develop the cells from a normal cell to a cancer cell. This figure is giving us the phases of RNA and the protein, where the RNA and the protein synthesis occur, DNA synthesis occur, and the phase where pre-meiotic phase or DNA synthesis is complete, where the mitotic or where the mutation are occur, or mitosis of cell are occur. The other line of the treatment for the cancer patient or oncologic patient is bone marrow transplantation. Types of bone marrow transplantation based on the sources of donor cell include, where we have the three types of donors. Allogenic. The allogenic is from a donor other than the patient, while the autologous is from the patient. We're taking a bone marrow from the patient. And syngenic. The syngenic is from an identical twin. If the patient have a twin, we are taking his bone marrow and giving it to the cancer, the patient with cancer. Nursing management in bone marrow transplantation have 4 lines: implementing pre-transplantation care and providing care during treatment, and providing post-transplantation care, which is most important line of treatment for the patient with bone marrow transplantation, and caring for the donor. Other types of treatment for the patient with cancer is hyperthermia, biologic response modifiers, and photodynamic therapy and gene therapy. We have to talk about the collaborative problems, which is potential complications for the patient in cancer based to the assessment data. Potential complications that may be developed, which include the following: infection and sepsis, hemorrhage, superior vena cava syndrome and spinal cord compression, hypercalcemia, pericardial effusion, disseminated intravascular coagulation, and syndrome of inappropriate secretion of antidiuretic hormone, tumor lysis syndrome. Also, we have to know that all of those complications occur to the type of tumor, to the region of tumor where it appears, and other considerations. Nursing process: the patient with cancer have to be assessed for infection, bleeding, skin problems, hair loss, nutritional concerns, pain, fatigue, psychological tissue, psychosocial status, and body image. The planning: we should have to plan according to the problem occur, and we give our goals. The nursing intervention is have many lines, which is being as a managing stomatitis, maintaining tissue integrity, assisting patient to cope with alopecia, managing malignant skin lesions, promoting nutrition, relieving pain, decreasing fatigue, improving body image and self-esteem, assisting in the grieving process. The evaluation for our nursing process is to have evaluate the expected patient outcomes by maintaining if the skin integrity or oral mucus membrane integrity is maintained, or either the tissue integrity is have adequate maintaining, the nutritional status if it maintained or not, and other evaluations such as pain and activity intolerance and body image and self-esteem and other expected outcomes, which is expected for the patient with the having a care from cancer. We have many nursing diagnoses. The nursing diagnosis is the key for our nursing care plan. We have many nursing diagnoses taking place in our lecture, such as risk for infection related to altered immunological response, and the goal of our treatment or our care, our nursing care, preventing of infection. There are so many nursing diagnoses for the patient according to their problems are listed in our lecture as we are seeing. Thank you for listening to my lecture. We are going to connect us, or there's a connection between them in the other lecture. Thank you very much.